Welcome back to the St. Johns County Morning News on 102.1 FM and AM 1240 WFOY. News, sports, and talk for St. Johns County. I'm Jenny Galino. Good morning. It is the first Friday of the month, so welcome to Affordable Housing Matters here on WFOY, a program on local housing issues presented here on the first Friday of the month, produced in cooperation with the St. Johns Housing Partnership and Mike Bond's Public Relations. Today, Bill Lazar, Executive Director of the St. Johns Housing Partnership, will be talking how affordable, clean, safe housing affects a person's health and well-being. Joining Bill is special guest Sally Reed, Housing Programs Lead at Flagler Health Plus. She works to coordinate services for permanent housing placement and improvement of overall well-being for individuals and families experiencing homelessness. She's a licensed clinical social worker with previous experience working in mental health, substance abuse, and supportive housing. Good morning.
Good morning. Thank you.
Thank you for being here this morning. Let's jump right on in.
Sure.
Right.
Well, we've invited Sally. We've been working together for a couple years now, but she's part of the Care Connect program at Flagler Hospital, which I just think is a huge help in the community because they're trying to help people navigate just the entire process of finding a decent place to rent in this town. And we all know that's becoming just scarce as hen's teeth for anybody. But for the folks that they work with who are going through some kind of a at-risk homelessness situation, who are just struggling to get back on their feet, you've really got to have someone help hold their hand. And Sally and them, they've created a great system over there just trying to find landlords that'll work with them, trying to help people. And it's something that, it wouldn't be there if it wasn't for Flagler Hospital's support. So it's a huge asset to the community. I refer people there all the time, but I just thought it was a great opportunity for Sally to come on and tell everybody a little bit about what they do.
Sure. So Bill said it. Sorry, Bill said it perfectly. So Care Connect is a program through Flagler Health that is focused on what we call social determinants of health. So someone's health is made up of a lot of different factors that the average person doesn't realize. We think about, your doctor, the medication you take, your access to healthcare, but really majority of your overall health, like 80%, is social determinants of health, which are your physical environment, your access to food, transportation, your social behaviors, your mental health, all of these different factors. So Care Connect really is a department focused on that other 80% and trying to help people access those resources to improve those areas and further improve their overall health. So of course, a huge factor of your physical environment is whether you're in housing and then whether you're stably housed. So my role really focuses on that housing piece.
And it just, there's an old housing term, it's called decent, safe, and sanitary. And that's just really critical because it's not just getting somebody into a place that, quote unquote, the rent is cheap, but you'd be stunned at the calls I get from people who don't have hot and cold running water in their apartment, who don't have a functioning kitchen. There's all sorts of housing code violations, but the tenants in some of these substandard rental, they're not going to turn anybody in because they at least have shelter.
Yes.
And so, Sally does that. I've worked a lot with the people from St. Vincent de Paul who help with rental. And they came to me one time and they said, Bill, we're really frustrated. We're paying $900 for a place that has mold and mildew in it. But it's the only thing that we could find for somebody. So, I really do rely on Sally and them help to sort of triage that. I mean, we're obviously always overwhelmed with the number of people who need help. But, healthy housing is a really critical part of just housing somebody because what they see on the flip side is if someone doesn't live in decent, safe, and sanitary housing, I said, if they have any kind of frail health issues, now they're coming to the public hospital for some kind of a, so now we're running up the medical bill. And I tell people all the time, putting grab bars in a shower is pretty cheap. Replacing a hip is $50,000. So how do we get all those grab bars in? Well, we don't have enough money to put the grab bars. Okay, well, one hip replacement, but you find the money in silos. So they're kind of bridging the silo approach by trying to get, to look at folks. And I always, as a landlord, I always look at it like I like partnering with them because my tenant comes with the village. who's trying to look at what are all the things that help them get back to normal. We're working on a project to build some apartments for at-risk veterans. And the reason I'm really doing it, besides the fact that I think we owe it to the veterans, is because Care Connect says we'll have someone working with these. We're going to put them into the unit. We'll pick them out for you, so that we have, but we'll also be there with them to help make sure they adjust so they remain stable. Because the landlord really just wants to collect rent, take care of the apartment.
Right.
Yeah.
Yeah. There's only so much,
Yeah.
follow up that they're going to do.
Yep.
Yes, and anything we can kind of mitigate if the landlord's having an issue, if they reach out to us, and a lot of the partner agencies we have that are working with clients more intensely when they're in housing, we'll try our best to kind of help alleviate some of that responsibility on the landlord, as well as to help the client. Sometimes if you've been experiencing homelessness for a long time, have different trauma in your life, it's a big ask to now manage money, pay rent. You're not used to paying a large bill at times, a huge amount of your income at times, to a landlord, as well as all the other factors of taking care of a home and being a good tenant. So however we can help the client and the landlord, we try to do that as well. And then, like Bill said, any resources that we're aware of in the community that the client qualifies for, we try to alleviate them from having to tell their story so many different times and go to these different programs, and instead connect them right to the one that they're eligible for, that has a resource available, and kind of guide them, because those processes can be overwhelming as well.
So, one of the things as a landlord, that Care Connect makes our job a little bit easier. I mean, when we have a vacancy, we'll get, last vacancy we had 80 applications in about 2 days' time.
Wow.
I mean, the demand is that high. But I want to call them because they've already got people, they've already kind of vetted them, they're already trying to sort of work with them. It means I don't have to go through all 80 of those applications. I just kind of call Care Connect and say, do you have someone who fits this box? And it makes it easier. I know you've got a sort of a stable of landlords that work with them, because they found out that Care Connect makes that tenant-landlord process just a little bit easier. And they're helping folks who really are struggling to find it on their own. I mean, these days, sometimes it's just hard figuring out where do you go look. They know. If you call them and say, I need help, they might know a vacancy, but they definitely know a couple landlords that you could contact to see what might be available.
Yeah, and like Bill said, I mean, we do it, of course, like we don't want clients in any kind of housing instability, but especially ones that are medically complex. I mean, I'm heavily in the homelessness realm, so I'll say experiencing homelessness just increases so many health factors, because you're exposed to the outdoors at many times if you're unsheltered. A lot of higher rates of tuberculosis, skin infections, things like that. So whatever to get that person sheltered can have such a big impact. I mean, just internally, we've looked at, like, when we've helped someone with housing a year prior to housing placement and then a year post housing placement, a 67% decrease in ER use.
Wow.
In what?
67% decrease in ER use.
Yeah.
So emergency
See,
room.
I mean, that's the thing that scares
That's
all
huge.
of us when we hear I have to go to the ER, and everybody immediately says, nope, I can't afford that. I'll take my chances with getting worse. And then obviously it gets worse and it becomes more expensive. So that's a huge success story.
Yeah.
I mean, that saves everybody money, about 12 different directions.
And just like, I think, every hospital, Flagler does a great job, I think, with, our client care, but.
I'm going to stop you
Okay.
right there. It's very rude. This music just kind of stops.
All right,
It
so
says
climbing
no.
music? Okay. My speech is too long.
We're going to be right back on WFOY with
No
First
problem.
Friday Affordable Housing Matters. Stick around.
Thank you.
Thanks.
So you're
Sorry.
still on, and you've already gone through 15 minutes.
Okay.
See?
See,
It goes
easy.
live.
All right.
Yeah, it goes really quick. The only thing is, this mic is finicky. You're going to
and
have to
I'm
like,
probably talking low. Oh, okay.
you have to get like really, it's awkward
all right.
close. I hate to
I'll
say
do
it, but yeah.
Tell them to behave.
Yeah, he's too.
Now we can start cursing.
No, you can't. Remember, we have Facebook Live. Behave, the two of you. It's great. Good, really
You
good
know,
stuff. So
we're
important.
doing this little 6-unit apartment complex called Patriot Place,
Mhm.
and I had started building it just because we had the opportunity to, and I get calls all the time from one-bedrooms.
Right.
But Sally and them had approached us and said, well, our big struggle is helping these veterans who are at risk, and most of the
Yeah.
time they're single. Occasionally
Yes.
there's a couple,
Like,
but all
pretty
they need
much-
is a one-bedroom.
Yes, like, and homelessness in general, we're always looking for single units. That's what's
Single.
hard. We'll have people come sometimes with like 4, 3 bedrooms, and it's, so, you know, we usually have people that need that too, but single rooms are really hard, and veterans, we're just really working to end veteran homelessness in St. John, so.
Yeah.
You know, that's just kind of one of the, and I'm an Army brat, so it really pisses
Right.
me off when I think people who, I don't, you know, we know so many people come back all screwed up from PTSD and everything else.
Yeah, I mean,
I was
it's
talking last
the
night to a young guy I know who, he works for the K9 for Warriors group.
yeah,
And you know, it's fascinating hearing someone who works there, all the training they do with the dogs.
yeah.
and-
I have them on the. I've had them on some few
and
times.
you know, but
Amazing.
they train the people, the recipients too. You know,
Oh, yeah,
because
for
they don't
sure.
want you having a dog you're not care. But you know, he said every so often they have to tell somebody you're not ready for a dog, and generally speaking, it comes back to the same thing because we haven't helped that person adjust enough yet,
They
and
need-
that's what I
they
really
need
like
more
with them is
support,
they've got
yeah.
someone. Still got what's the young guy's name?
Oh, Michael.
Michael.
Arnold is a veteran peer we have that's works in my department.
So he'll be like a mentor
Mhm.
with all
That's
6 of
awesome.
them, you know. And as a landlord, I don't want to deal with the social service side of it,
Well, no,
but I want
yeah.
to know that someone's going to round through, check with each one of them, seeing
Sure.
if they're okay, what do they need, and we've got Bill Dudley over at the Veterans Council
Mm-hmm.
who said they need anything at all, furniture, toiletries, let us know.
And they've been doing that for us for quite some time, like the furniture. They furnish apartments all the time
Oh,
for
that's
us. But I
So
do
you
want
got
to
them
say,
to cover that
That's how
part.
they kind
Because
of put
that's
all
a
the pieces
huge. I
together.
mean, there's so many factors, right? Like so many
Yeah.
layers.
to make it feel like a home. You're not just, that was a thing when we moved people in. We didn't realize, you know, you think, oh, now we have the house, but then there's nothing in it. How cold that
Yeah,
feels. So it's like,
big-
oh, okay, well, let's
Yeah.
get some stuff together. But I want to say your staff, I know you guys, you're saying you don't want to do the social services part. I feel like your staff does
We do.
a lot.
I feel like
social
they
service.
probably are
They do.
very,
I just
very
wanna say
You know,
good.
it's what we were talking about earlier. I mean, in the nonprofit world, it's kind of interesting. We all do work that the for-profit folks want to do, and we're expected to do it for less.
Oh yeah.
And then on top of it, what all of our employees do is very specialized, just in terms of networking and everything else. I don't want to lose any of them, you know. And
Right.
I've bumped everybody up to at least $20 an hour simply because that's what it costs to live in this town. And I hate retraining people. The last thing I want to do is see someone leave, and then I've got to go through that whole.
Right. It's
Startup.
not
Yeah.
worth it for you,
Yeah.
right? All right, Leonard Skinner, bring
All
us
right.
back in.
They did the Breakfast Club from 1973 when I was at Fletcher High School.
Is that right? Look at you. All right, remember, close to that mic.
Okay. So everybody can hear me.
Welcome back to the Affordable Housing Matters. You can make a difference in what has become an affordable housing crisis in our county. Our workforce, ranging from teachers to first responders and restaurant workers, are not able to find decent, safe, affordable housing in one of the most prosperous counties in our state. The elderly and local businesses are also suffering. Here's how you can help. If you have a property or land, contact the nonprofit St. John's Housing Partnership. If you are not in a position to donate to the affordable housing over there, you can possibly, the St. John's Housing Partnership can possibly purchase and build affordable housing for community members, and you can also make cash donations, bequeath a gift. St. John's Housing Partnership can give you further information about the tax and financial benefits of these and other gift methods. Visit www.sjhp.org. Just wanted to get that in real quick
Thank you
for
very
our
much.
listeners to let them know sjhp.org if they want to learn more about the St. John's
Great.
Housing Partnership. Welcome back.
Thank you.
Sorry I had to cut you off.
No, you're
It's
fine.
very rude, but you know.
Do you remember what she cut you off of
Yes,
saying?
yes.
Okay.
Luckily,
Repeat it.
it's
Let's
surprising,
continue.
but yes. So we were talking about people, needing emergency care when they're living, with housing instability, how it impacts your health. So just that, I think no matter how great the emergency room is at Flagler, it's still, we don't want to go to the ER like you're saying. No one wants to go through that whole process and receive such a high level of care. So it's a lot on the client. So to prevent them from having to receive that type of care and keep them in good health, I mean, that housing stability and having safe, decent housing is such a big piece of that. I mean, we had a guy that we housed last year, and when we met him, he was living outside, unsheltered. He has a slew of medical issues, COPD, he had a lot of abscesses, some gastro issues, and, was living off of disability income, which is very low. He was unable to work. So just him alone, that year he had been to the ER 12 times. I mean, that's a lot.
It's a big price tag.
Oh,
Basically
wow.
once a month, and it was a lot on him. I mean, you could just see it when speaking with him that he did not feel good. He was not doing good in the Florida heat, as I can't imagine how that has to be outside every day like that. And now that he's been in housing, not only it's very evident how different he looks, how different he feels, how happy he is. But we looked at his ER use the post year, and only twice. And both of those times were pretty close to him being housed. So in my head, I'm kind of like, that's probably still
the hangover from the last
yes.
stuff.
But now he has, he's able to prepare his food. He's able to, keep track of his medications, his doctor's appointments. All of those things are kind of slipping through the cracks when he's kind of in crisis mode outside. So it's unbelievable the effect it has, really.
And see that, if you think about it, the cost for those ER visits, I bet, is more than the cost of their entire program serving that guy for a year or two.
Absolutely.
It is, and what's important to me is it brings that quality of life back to that individual. I don't know who was where, what path in life he walked through, but he's now getting back stable. And that's where we need everybody to sort of put their heads together and think. I want to just ask. I got a call from Bill Dudley at the Veterans Council yesterday. He's got a veteran. It's actually a husband and wife. The guy's working. They're both sleeping in their car because they can't find any kind of a one-bedroom or anything. So if anybody out there has a one-bedroom apartment, a garage apartment, anything that is set up, please give us a call, 824-0902. We want to just try and get this couple situated in something safe. If they can get a 12-month lease, great. If they can stay for 3 or 4 months, we at least get them out of their car, and we have more time to find them something. But they're working locally. They just can't find a place. And one bedrooms are one of the hardest things to find.
Mm-hmm.
And that's where, we were just talking about, we see the biggest need is one bedrooms. And especially with, veterans, there's a lot of reasons why shared housing is sometimes more challenging because you've experienced a lot of trauma, sometimes in your service. So
You need your space.
You need your space and to feel secure in that space. So yes, one bedrooms definitely.
We're partnering on building a place. It's called Patriot Place. It's 6 one-bedroom apartments. Hopefully we will be done by the end of the year. Sally's been pestering me since June to finish it.
We're just excited.
But it happened in part because the county gave a density bonus to a developer, a company called Mountain Star Capital, and they bought the land, donated it to us. We need everybody to look around. This is still a relatively small community. Mm-hmm. There may be churches that someone left them some land, and it may just be a simple lot somewhere the church doesn't have any plans for. It could be a bigger piece. But we want everybody to think, if you've got a piece of property that could be built, if someone donates it, it's a lot easier to build one-bedroom units on it just because of the cost of doing something. But we just hope everybody will take a look around. I hope that churches look at sort of their property inventory and say, do we really have a plan for all this? Or, they could sell, they could partner with us, they might do something on their own. But think about, if you have a piece of property, could we build some kind of affordable housing on it? Sally's got people that, could occupy it from day one.
Yes.
It's just, it's a matter of just trying to put all these pieces together.
The need is there.
Yeah.
We just need to fill it with these one bedrooms. Yeah.
Mm-hmm. And in that price range, that affordable range, we have a lot of people that are at 30%, AMI, a very, lower income, living off of Social Security or disability income, but also those that are in a higher AMI but still start struggling. There's a lot of long wait lists for affordable housing in St. John's. So
and our biggest challenge, she works with people that are, according to the federal government, are technically homeless, which means they're literally living outside. Bill's definition of homeless is if your name's not on the lease or a mortgage, you're at risk of being homeless. Only so long Dad's going to let you sleep on the couch before it's like, oh, Bill, time for you to go, and now you're really in crisis. So we have a lot of folks, and a lot of them, besides the folks Sally works with, are part of our tourist industry. They are the backbone of our economy. And
that's what
if
I
we
think
lose
we
them,
miss.
our economy
We're
is
missing
really
that
on the verge.
point. Yeah.
Your servers, a lot of those that are operating different, tourist activities. I mean, it's hard for them to find housing to be able to support, those businesses in our community. But also, like you were saying earlier, teachers. I mean, in every workforce that I hear lately, it feels like there's staffing shortages.
How much time?
We're good. We've actually got a couple of minutes.
All right.
How about before the music cuts you off again?
So it's just, but this is, again, tell people how to reach Care Connect,
Yes.
because
Yeah.
they may know
Absolutely.
somebody,
Sure.
they may need your help themselves.
So again, we've talked a lot about housing today, but like I said, Care Connect is an operation of Flagler Health, and we look at any resource, whether that's transportation, food, any kind of social health resource that you're in need of. You can go to careconnectplus.com. It's a really short application. We are just gathering some basic information regarding maybe your income, your household makeup, and then you'll receive a call from a community health associate who will gather some more information and start looking at resources that you're in need of together with you.
And for lack of a better term, what kind of business partners are you looking for? How can people help y'all help other folks?
Sure. So, of course, like Bill said, if you have a rental, feel free to reach out to us. We're always looking for rentals. That's such a need. But honestly, whether it's volunteering your time, we always, we have a volunteer pool we're looking for always, as well as, donations. There's a way to donate to careconnectplus.com. And then we work with kind of just a large amount of agencies in the community that you will see on our website. And any way you can assist them, whether it's volunteering or donating, that helps all of us, because we're all working together to, whether it's ending homelessness or housing instability, or just better serve our community and improve health outcomes.
I love it. This is great.
Thank
I
you.
love this show. I look forward to it every month because it's such great information that we don't know. That we, if you're not in it,
Right.
you really just
Well,
don't
and
know.
the thing is, I've been doing this for 32 years. I moved here in 95 and started working here. But I talk to people all the time about housing stuff, but you'd be surprised how many folks go, oh, yeah, I heard him, but I didn't think it applies to me. And then suddenly, oh, now it does. What was that?
Now it
Where do I
does.
go?
Right.
Yeah.
And
Right.
so it's always, we appreciate the opportunity to do this because, Sally will say something now, it doesn't resonate with someone, and 3 months from now, we need to have her back talking about
Absolutely.
it again, so people are reminded.
Well, you never know, what can occur in, your life from day to day, and you'd be surprised, the stories we hear and how dramatically your life can shift.
Absolutely.
Well,
And
in
the need of
this,
services.
this town, the biggest challenge is we've got landlords that I think are kind of burned out between COVID and everything else, and they're selling.
Right.
And when they sell, the tenants suddenly see a $300 increase in rent, or they're just told, please leave because we're doing something else.
Right. Well, thank you so much, guys, for being here this morning.
Sure.
This has been
Thanks for
a
having
wonderful show. First Friday Affordable Housing Matters program on housing issues, presented by WFOY and produced in cooperation with the St. John Housing Partnership. Join us again Friday, December 2nd at 8:30 a.m. Thank you all. Have a wonderful weekend, and thanks for listening to 102.1 FM and AM 1240 WFOY. All right.
Thank you, ma'am.
Thank you very much.
Awesome. All right, so let's say goodbye to Facebook.
All right,
We had a
bye.
bunch of watchers today. That's
All right.
awesome.